Good afternoon. My name is Barbara Savage. Today I want to speak to you about the ongoing issue of Medicaid expansion through the Affordable Care Act between the federal and state governments in the United States. What is Medicaid? Medicaid is a joint state federal health insurance program for low-income mothers and children, the elderly, and people with disabilities. Despite having little to no interest in taking on new responsibilities, states are cognizant that healthcare is a necessity and unavoidable. According to Smith and Greenblatt, Medicaid expenditures started rising quickly, providing health insurance and services to more than 68 million Americans. Approximately 24% of a state general revenue goes to Medicaid. This large funding sparks controversy between political parties, resulting in partisan politics. For example, most Republicans oppose the Affordable Care Act and its expansion of Medicaid. The top 10 states with the highest Medicaid expenditures in millions of dollars are California, at number one position at $88 million, followed by New York, Texas, Pennsylvania, and Florida in fifth place at approximately $22 million US dollars. In sixth place is Ohio, followed by Illinois, Massachusetts, Michigan, and last, New Jersey at approximately $15 million US dollars. Initially, the Medicaid expansion appeared to be attractive, wherein the federal government covers 100% of the costs over 3 years, between 2014 and 2016, and no less than 90% thereafter. Already, Medicaid eats up a sizable percentage of state budgets. States pay, on average, 43% of traditional Medicaid costs. In 2014, total spending on the program nationwide was $496 billion. What are some of the benefits of Medicaid to states? According to Smith and Greenblatt, one study found that during the first 4 months of the Medicaid expansion, uncompensated care of patients without insurance dropped by 30% at 465 hospitals in 30 states that embraced the new program. In opposite, states that refused Medicaid expansion showed no change in the amount of uncompensated patient care. The high cost of uncompensated care is the primary reason that hospitals have been pushing states to accept the Medicaid expansion. Obamacare remains unpopular with the public, with many people disliking the law. Residents pay federal taxes and thus underwrite the Medicaid expansion, even if their states don't participate. Medicaid costs are expanding fastest in states that have accepted the expansion, but costs rose at a rate 50% lower for those states themselves in 2014 and 2015 than for the states that blocked the expansion. What are some of the contention or issues between both governments? The primary issue or contention is the state government is skeptical that the federal government would pay its promised share. To many, it would not be the first time Washington started a program and then left states to make up the difference when funding dropped. According to Scott Walker, governor of Wisconsin, we believe in the end the track record of the federal government has been to pull away from their commitments to the states. We believe confidently going forward to this federal government is likely to renege from its promises and Medicaid to the states, and we won't be exposed to that. To Smith and Greenblatt, while the Affordable Care Act largely forbids states from reducing the number of eligible residents for Medicaid, it does not stop them from reducing coverage in certain ways. For example, in 2012, the state of Florida cut the number of days most Medicaid patients could spend in hospitals from 45 days to 23, and Maine eliminated coverage for podiatry, optometry, and dental care. Subsequent to the reduction in this service, the state was sued, forcing them to create a more modest program. These problems are an indication that the states and federal government have been at a tug of war over Medicaid since 2010. And while the goal of the federal government is to use the Affordable Care Act as a tool to expand health insurance to millions of Americans, states want to cut back to save, ultimately reluctant to expand. To Smith and Greenblatt, if less persons are uninsured, less persons will seek medical attention in emergency rooms, leaving the state with high costs. The health and welfare of residents or taxpayers is of utmost importance. A great economy needs the input of both governments. To improve the intergovernmental relationship between both governments, the federal government must be more inclusive. Having an input in the decision-making process, especially in rolling out large programs such as the Medicaid expansion, allows states to respect the process, not feeling they must comply. States already feel that the government is known for not keeping up its end of the bargain. The federal government must create a platform to build trust, allowing more cooperation and partnership. This will help to eliminate partisan politics, encourage successful initiatives, and improve intergovernmental relations. For the first 3 years of the Medicaid expansion program, between 2014 to 2016, the federal government paid the full amount, followed by a reduction in contribution to 90% from 2016 onwards. Since its inception, there's a change in the government, and partisan politics has played a role in the revamping of this program. States must also contend with a change in political climate, which will ultimately affect this decision-making process. Medicaid expansion is costly, but a good program for states. Not only will there be an increase in the number of persons with healthcare coverage, but growth in the economy through the billions of dollars being pumped into the system through the federal government. While states would like to refuse funding, having financial resources will have a significant impact on the state's economy. And to move forward, both governments must have a mutual respect for each other's territory. Thank you for listening, and feel free to make your comments through Canvas. Thank you again.